Hi, this is Dr. Jay Hartley at the Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. And today I have with us Olivia Peoples. Olivia is a past Florida high school state swimming champion. She also swam at the University of Florida and was an SEC champion, and recently was a silver medalist at the NCAA championships. And the reason I brought her in today is because when I was in chiropractic school back in the late 80s and early 90s, we would see studies that would say that swimming was good for scoliosis. Well, in the last few years, 5 to 10 years, multiple studies have come out, and what it shows is if you have a progressive scoliosis, a scoliosis that's progressing from 20 to 30 degrees, that the odds are, if you're swimming as a competitive swimmer does, many hours in the pool per day and almost every day during the week, that swimming actually puts you at risk of the curve growing. And so Olivia's mom brought her in at the end of her high school career. The goal was to help her performance, but also help to control or maybe reduce this curve, even though statistically we knew that if you already have a 30-degree curve and you're spending all that time in the pool, you're probably going to have an increased curve. And so Olivia has just graduated from the University of Florida, and she's going on to osteopathic school, but the end result of her case is really awesome. So when she first came in to the clinic, her thoracic curve was 29 degrees, and our picture that we took last year was 24 degrees, and her entry in the lumbar curve was a 30-degree curve her senior year in high school, and now it's an 18-degree curve. So even though she put herself at great risk with taking on this swim scholarship, her curve actually, with the care we've done and using the ScoliBrace, has actually reduced her curve. So I wanted you to share a little bit about your experience at Florida, Olivia, and how many hours were you actually in the pool in college?
So I swam about 3 hours a day throughout the weeks, and then we also did weight room activities and other kind of we call it the dry land, kind of core circuits and med ball circuits as well, and that would be for an hour a day, 5 days.
Yeah. So based on these studies, if you take somebody with a 30-degree curve and they're in the pool for 2 hours a day, 5 hours a week, statistically their curve is going to increase. So with the use of the clear scoliosis method and the ScoliBrace, we were actually able to reduce your curve even though you were at such high risk for the curve progressing, which is really awesome. Now, how about your performance? How do you feel like the care that we've offered you has helped your performance in the pool?
I mean, I think it's tremendously helped my performance. And we talked earlier about the fluidity that I got from treatment here, which is super important for swimming because you are literally in fluid and you have to move with the water, and when you're all locked up, you can't. So that, in combination with the breathing and just the reduced pain, allowed me to train harder than maybe I would have otherwise, just because that load would have been so heavy.
Yeah, talk a little bit about more with your breathing, because I remember when you first went to Florida, and even though you were swimming at a high level in high school, when you went there, the intensity of the workouts was a little higher, and if you're not breathing correctly, if you don't ventilate or have a neurological breathing from your upper neck, it can really create a lot of stress and increase your breathing issues, which creates anxiety and really can affect your workout. So talk about that with your performance a little bit.
Well, not only was the volume increased, but I also went from training outdoors to training indoors, and that was a really big experience as well. So on top of the volume and the kind of mechanical aspect of breathing, the chemical part was also part of a huge adjustment. And so if I had both mechanical and chemical working against me, I mean, I can't even imagine. I don't think I would make it through practice. So being able to get air when it felt really hard to come by at that point because I was training indoors, that made it so much better. And that was a big adjustment in my senior year of high school after we came. That was part of why we showed up in the first place. And I actually adjusted my training in high school to account for those breathing issues I was having. So instead of having to adjust for that, I was able to adjust my breathing to account for the volume I was now getting. So my swimming could flourish without my breathing holding it back.
Awesome. Anything else you'd like to share about the care in the office or your experience, what you like the most about it?
Competitive swimmers that are swimming at such a high level are getting more scoliosis because it's such a repetitive sport that if you've got muscle patterns that are working against you and you're just ingraining curvature into your back, like I'm doing that so much that whatever I've got going on, you're going to get more of it because I'm doing the same strokes for hours a day. And I'm not the only swimmer that you see. You've seen a couple others,
Yes.
right? Yeah. So, yeah, it's not uncommon, and it's not just a dip in the pool for a couple hours throughout the week. Like, I'm sure that's helpful for scoliosis, but the repetitive motion of swimming and the fact that it's not an impact sport, that it really is just your muscle patterns because gravity's not working with or against you either. It really highlights things that are wrong.
Yeah.
And another thing I want to note is that my curve got better in spite of not even being in town, because I only came in about once a month for most of my college years, but having the brace and having the exercises that I could do that you guys equipped me with allowed me to keep that progress that we were making, even though logistically it was hard.
Yeah, awesome. One of the things with the risk factor of the swimming is one of the risk factors is in other sports like volleyball, ballet, they cause hyperextension in the thoracic spine. And so although swimming, you're not hyperextending your mid-back, the muscles that would put you in hyperextension are contracting like the whole time just to keep your body flat in the pool. So they think that the mechanics of why it makes the scoliosis worse is that's part of it. It's creating that lift or hyperextension in the thoracic spine, not necessarily that you're, like in a volleyball position or a backbend position the whole time, but the muscles that would do that are engaged the whole time you're in the pool for the 2 hours. So like you're saying, if the muscles are already out of balance, typically what happens when you do intense exercise is the ones that are already strong get stronger.
Mm-hmm.
So, not only you're in the hyperextension, but you're high intensity, which is going to make the curve worse, I think is one of the theories that are out there.
I can definitely vouch for that.